Hi guys, welcome to our YouTube channel.
We are the young urban women from Africa to Kun, South Africa.
Every week, we'll be discussing issues that affect young women in our communities.
Issues such as decent work, unpaid care work, and sexual reproductive health and rights.
This is where we aspire
to inspire and never expire. So don't forget to hit the subscribe button below.
Like, share, leave a comment, and stay tuned.
Yes, hey everybody, my name is Notgelelo Kunju. I'm a social auxiliary worker in La Ekaya. We are here namhlanje talking everything sexual and reproductive health related. I hope you enjoy this. I'm not here alone, I'm here with the girls. Girls?
Hi everyone, my name is Tepiso Sohoka and I am Utando Santanez. So please guys, make sure you comment, like and subscribe our YouTube channel.
Hi ladies and gentlemen, my name is Dumisilum Simanga. I am a young urban woman, active citizen, and we are here today engaging on conversations that matter. So the motive is that we inspire people and get as much knowledge and information that is needed. So yeah.
Hey everyone, my name is Lerato Moyo. I'm the CYG facilitator and I'm also a young urban woman mentor. So we are here today to actually give information so that young people can be able to make informed decisions about everything that shapes their lives.
Ma'am, we would like to know, what is sexual reproductive health and rights?
When we speak of sexual and reproductive health, guys, we are ladies rather. Or guys, it's fine.
Yes.
When we speak of that, we are speaking about matters pertaining to safe sex. We are speaking about matters pertaining to planned and unplanned pregnancies. We're speaking to matters pertaining to contraceptions, termination of pregnancies. So we're speaking the general health of our sexual lives and reproductive health, reproductive lives rather.
And accessing health
and
rights.
accessing. So when we speak about the rights element, we're speaking about the access of these services. Where do we go to access these services? How easy is it for us as young people to access these services? And if we do so happen to come across facilities that do not want to service us, where do we turn to advocate for our rights or to demand that we be given these rights or these services rather? That's what we're talking about.
So ma'am, our second question is, why is it important for us young women to be more serious on sexual reproductive health and rights?
I love that question, Yonela. It's very important because, guys, you don't want to find yourselves in my position with a big belly in school. It's important that I show them an example here. But it's important to have these engagements, guys, so that you may have the information that will enable you to make the correct and wise decisions that will help you improve yourselves, develop yourselves personally without hindering your future in any way, right? So I suppose that a lot of parents, when we engage in these conversations is they are worried about in a way we are teaching you guys to be promiscuous or we are encouraging you guys to go out and have sex. That's not what we are doing. I think what we are doing as professionals is to say we know that you guys are already having sex, of those who are. And if you are having sex, you should not firstly be condemned for it. sex is not a crime. Sex, I feel for me, is a basic human right. If there is, it's a basic human need. And it's not for us to decide when you should or should not engage in it. But what we are saying as professionals is to say that have the information to be able to, access services that will enable you guys to engage in safe sex so as to prevent unwanted pregnancies, first and foremost, prevent transmissions of HIV or HIV infections, prevent STIs. We don't want any of that. We want you guys to complete school, go out to make to develop yourselves personally and professionally before you are burdened with the responsibilities that a child comes with. Right? You're not mentally prepared for that. You're not emotionally prepared for that. Least of all, you're not financially prepared for that. So this is the reason why it's important, to answer your question, Yonela, to engage young women, but not just young women, to engage young people generally, to engage your young brothers as well on these conversations, but particularly you, because you guys are a vulnerable group. I get it because you like nithanda izinto. So y'all as on some asifuni ukudata uThebo who oseklasini yami ngifuna ukudata a guy who's doing his second year university, right? Because because me ngimdala like that. But you don't understand the power dynamics that come within that relationship in itself. So it becomes difficult for you guys to negotiate things such as condom use. Right? Because he's older, uzokushaya khuluma izinto zokuthi, you know what, don't you trust me? Are you busy with somebody else other than me? Or our
size a condom.
The size, this thing, it's too small for me. Baby, I'm big, So we don't want you guys to fall into those traps. We've had young people falling victim to those traps before. As it stands currently, the statistics tell us that in South Africa alone, 2,000 adolescent girls and young women contract HIV on a weekly basis. That number is shocking. We don't want to have new infections of HIV. But what we are saying is we want you guys to protect yourselves. And in the unfortunate case that you do find that you have contracted the HIV virus, what do I do from then on? Treatment options. You need to know of such information, getting on treatment immediately to ensure that your CD4 counts and viral loads remain suppressed. Do you understand what I'm saying? So there's a lot that comes with sex other than the activity in itself. It comes with a lot of consequences, and this is the reason why we continuously engage. We're not trying to scare you guys. We're trying to give you the information so as to enable you to make those decisions by yourselves. Yeah.
True. And also, can I add something?
Please do.
As I've always said, guys, during our sessions, that if ever you are going to be engaging in sexual activities, we know that you might be having sex, but what kind of sex is that? So we are trying to say, guys, please, can you make sure that if ever you are going to try or to test drive or whatsoever the case may be, you must make sure that it is safe sex.
Absolutely.
It must be with a condom.
True.
You understand? Because you must know the consequences that come along with unprotected sex, even sex on its own.
On its own.
You understand? So if ever you are going to fall pregnant at your age, still at school, you are still expecting your parents to buy you school uniform and textbooks, and that is what they want to buy. But now they have to divert and buy what? Diapers. You understand? And that is not their responsibility. It is your responsibility. It goes with these consequences. So if ever you're gonna choose to have unprotected sex, you fall pregnant, you contract STIs, infections, you must make sure that you go to the right service providers, the clinic. You have to be tested for those things. You have to take medication so that you disinfect whatever that is there. You understand? So if ever you are being infected, it's not something that you have to be ashamed of. You hide it up until it gets inside your womb and it destroys your reproductive system.
True.
You understand? So I've been saying this. I know you guys are sexually active, some of you who are open to say so or to share. But make sure all the time when you have to do that, you are we play it safe.
And I think also just to add on what Mem Lerato and Ziggy have already emphasized on, specifically on safe sex. Contraceptives do not say Guti, you can have sex without a condom.
Yes.
Contraceptives are there to only prevent you from pregnancy. But the moment you say I'm on contraceptives, I'm not going to use a condom having sex, you are going to get exposed to STIs, STDs, and whatsoever.
Yeah.
So as much as you are going to be on contraceptives, it's always important to have a condom. There's a male condom, there's a female condom. So really, there is no excuse of not having safe sex. I mean, there are clinics whereby you can access condoms for free, you can choose to buy them and whatsoever, but really, emphasis on safe sex.
Yeah.
And the other thing, ma'am, I think they should also take responsibility and face the consequences. For instance, don't listen to your peers.
Yeah.
Never listen to your peers. And don't have sex because of your partner. I think it's very important to be responsible of what you are aiming to do.
Yeah.
Do the right thing, think about what you're going to do, and take notes on everything that we are teaching today, and make sure you go to medical services for more information.
Yeah, absolutely.
I have a question.
Yes, ma'am.
So before the energy of this becomes, stay away from sex, right? Because there is obviously a reason why people have sex, and there is a choice in the matter. But if I'm hearing you guys correctly, you are highlighting that sexual health is in every different level. Sexual health affects financial health. It affects mental health.
Yeah.
It affects your social health.
Yes.
Right? So I think just to highlight what the links are, right, between sexual health and how does it affect your finances? How does sexual health affect your education, right? The health of your education. How does it affect your family life? So that when you're making a decision whether to have sex or not to have sex, you're making an informed decision, right? To say, I understand the consequences, like you said, Ziki, for each of those levels of their lives. So can you guys make that link for us? Yeah.
Absolutely.
Yeah.
I think just also to emphasize this, we are not scaring you guys or telling you to stay away from sex. We are saying the decision is yours entirely. Nobody is depriving you of sex. We are only encouraging you to engage in safe sex. Because the results of not engaging in safe sex, coming to your question now, case scenario, I'm a 15-year-old and I've just fallen pregnant. And the guy who's impregnated me is 23 years old. He's in varsity. So we are both financially dependent on our families. We live in a country where predominantly our fathers run away from responsibility, parenting responsibilities. So it's easy for him whether he denies the baby or not, but it's easy for him to just not take responsibility. And at most, we don't even know the avenues of going to ensure that he does take responsibility. So here you are, coming from Hillbrow, being raised by a single mother yourself. You're a 15-year-old, you're pregnant, your mother's a domestic worker. The money she earns it's not able to keep you guys afloat. Now imagine with a third mouth that's coming. Umntwana is not just a financial responsibility. Umntwana needs health care. Umntwana unama complications, right? Healthcare services, unfortunately, that we access are public healthcare facilities or services which aren't really good or are not of quality. Right, we face negligence in hospitals there or in our clinics. So what happens is you are forced to go and sign up umntwana for ISASA, social support grant, child support grant. That in itself, 420.
It's 420, but now it's 940.
No, it's only 940 because of COVID, but it's actually 420.
It's
you cannot raise a child on 420 rands in a month. The next thing, what happens is we find your mother coming to Africa Tikkun to access social support services because they require or they are in need of food parcels because you guys can't even afford basic necessities such as food. The money that she has, the money she's able to make is only enough to cover rent because of the high cost of living in these areas. Do you understand, Uguti? Financially, you are in no position to be having a child.